This is a joint meeting between the Community Development Block Grant Committee and the Mental Health Board. And it's wonderful to have everybody here. And I'm thinking to start off, why don't we go around and each introduce each other, ourselves, and say which committee you're on, and maybe why you're on there. I'm Ann Rainey. I'm the Alderman of the 8th Ward, and I'm just found out yesterday I'm chairing this committee. Thanks. Thanks for the late notice. All right, so I'm going to go this way. All right, so Derek.
Hi, thanks, Sam. Hey, everybody. My name is Derek Ohanian. I'm a resident of the 3rd Ward, and I am on the Housing and Community Development Act Committee because I really care about equity throughout kind of our economic development within the city and also access to dignified housing.
Excellent, excellent. Sarah, could you call people, because people keep moving around and you're managing this?
Sure. Irene.
Irene.
Yes, hi. Pardon the color in this. My camera here today is weird, but I'm with the Mental Health Board, have been on it for about 6 years now, and very involved. I'm a social worker by training and still involved in that professionally, and have done a lot of work with persons with mental concerns, mental illness, and mental health issues. And so that's where a lot of my commitment comes from.
Thank you.
Thank you. Hugo.
Thank you, Sarah. Hugo Rodriguez. I am also a resident of the 8th Ward, and proud to be an Evanstonian for the last almost 20 years now. I love the community. I love to serve in this committee and hopefully with time make a difference to benefit the less fortunate within our communities.
Thank you.
Arcana, did I get that right?
Archana.
Archana.
Like
I'm
Archie?
sorry.
Archana.
I apologize.
No worries. That's fine. My name is Archana. I've been on the Mental Health Board for about a year now. So a little over a year, actually. I started through as part of Nathan, who I'm not seeing here right now. I'm a psychiatric nurse, and presently I'm in school for my psych mental health nurse practitioner. So I'm hoping to be more involved in the mental health needs and development in Evanston community.
And would you tell everybody what you did this morning?
I'm doing my clinicals. So I was via Zoom. We were seeing patients with my preceptor, who is a psych nurse practitioner. So we were all on Zoom doing patient care via that.
So when are you going to get your, is it a degree? It's a degree, right?
It's a degree, and then I have to sit for my license,
okay,
which I'm
so
hoping to.
When will that be?
Hopefully by middle of this year. Because everything has to be submitted to the credentialing community and then sit for the license exam. So fingers crossed.
Very impressive. We're all rooting for you.
Thank you.
Thank you for serving on this committee. It must really add to your load.
I'm looking forward to it.
Okay, thanks.
Alderman Wynn.
Mental health.
I'm just trying to keep us going.
Okay.
Hi, I'm Melissa Wynn. I'm the alderman for the 3rd Ward. I've been serving on this committee for the last 3 years. 3 years, yes. Traditionally, all of the aldermen who have target areas, CDBG target areas in their ward serve on this committee, and that usually fills up all of the spots. The 3rd Ward doesn't have any of the target area in it, so there was an aldermanic seat available at the beginning of this council, and I was very excited to be able to sit on CDBG because I've always been really interested in this subject. So I'm very happy to be here, and I'm really interested in the changes that we're making this year, and to see how this rolls out.
Thank you.
Sandy Johnson.
Yes, Sandy Johnson. I live in the 1st Ward at this point, and I've been on the mental health board for about 7.5 years right now, and I was trained as a clinical social worker.
Hey, Sandy.
Alderman Wilson.
Thank you. I'm Don Wilson. I'm the Alderman in the 4th Ward. I won't have everybody listen to my 12 years of reasons for doing this, but generally speaking, I like participating in this committee, and I have been the entire time I've been on the council, because we do support a wide variety of needs in the community, and I also feel like it helps me stay dialed into what those needs in the community are.
Alderman Ruth Simmons.
Good evening, I'm Robin. I'm the Alderman in the 5th Ward, and we do have an impact area. I have been on the committee for 4 years, and I enjoyed traditional programming that might have been funded by CDBG type dollars in my upbringing. I'm a product of family focused programming, and they are one of the organizations that we generally support. So happy to be here.
Becky Filer.
Hi, I'm Becky, and I am in the 3rd Ward, and I have been on the Mental Health Board for 3 years, and I'm an LCSW, and I currently work in various nursing homes through a company called Impact Healthcare, providing therapy.
Thank you for what you do.
Thank you.
I think that's everybody on our boards or commission that are here.
Okay. All right. Thank you, Sarah. Don Wilson, Alderman Wilson, will you move to suspend the rules and read the governor's thing?
Yes, thank you. I move that we suspend the rules to allow us to proceed with this meeting utilizing the Zoom video conference software in lieu of an in-person meeting and in accordance with the governor's prior directives related to the COVID-19 pandemic.
Second.
And I can call the roll for this.
Yes.
Alderman Rainey.
Aye.
Derek.
Aye.
Irene.
Aye.
Hugo.
Aye.
Arcana. I'm sorry, I keep screwing up your name. Akna.
Aye. Archna.
Archna. Oh,
Like
I am so
Archie?
sorry.
No, that's
I
fine.
am so sorry. Alderman Nguyen.
Aye. Mhm.
Andy Johnson.
Aye.
Alderman Wilson.
Aye.
Alderman Ruth Simmons.
Aye.
And Becky Filer.
Aye.
All right.
Right.
Thank you.
Thank you very much. So the first item on our agenda is public comment. Last I heard, we have no one signed up for public comment. Has that changed?
That
It
has
has-
not changed, but we do have 6 people in the waiting room and 1 hand up. So with the permission of our
Yes.
body, I would like to invite people to attend, and then I can reassign them as panelists, or I'm sorry, as participants.
If there are no objections, and I'm sure there are none, yes, please invite all of our guests in. And if there are any people who did not realize I had to sign up, please invite them to speak and get their names. Okay.
Hi, this is Tina Payton. Hi, I hope everyone's well. So I don't think it was this meeting, one of the meetings, but Sarah, you said that you were going to see if there is some CDBG funding that was possibly used or could be used for rapid rehousing. I think you said it was 50,000 or 55,000 or something to be used for rapid rehousing. I wanted to know if there was any update on that. And then, so I wasn't quite clear. The city manager said at one time that the $500,000 that was given, to help the landlords, she said that 50,000 would be used to help landlords repair their property. Is that true, or what's the deal with that? So I just had those couple of questions.
Alderman Rainey, would you like me to address them, or would you like me
Yes,
to?
please.
Okay.
Would you, for some who might not know what Tina was speaking of, would you explain the 500,000?
Sure. Let me first address the question about the money for rapid rehousing. It's not CDBG CV, it is actually, we have some ESG CV, which can be used for rapid rehousing and can be used for prevention funding. Now, we'd allocated $50,000 for prevention funding, which is to help people who are in housing but who can't pay. Rapid rehousing is what we use to put people who are homeless into housing. So just so everybody understands the difference. There is need for more prevention money than our 500,000 or anything else, to tell you the truth. And the reason we were thinking of seeing if we should move it to rapid rehousing is during the eviction moratorium, with ESG prevention money, a tenant has to have an eviction notice in order to be eligible for prevention money. And so HUD says you can't use it because people can't file eviction notices because all of these tenants have to be under 50% of area median, so they'd be eligible. But we also learned that Chicago got a waiver to that. And so we are trying to find out if we can use that waiver and be able to use the funding for prevention. One of the things about ESG prevention funding is it can help tenants for a much longer period of time than the $500,000 of CDBG funding, CDBG CV funding that is being used. So CDBG CV can be used for only up to 6 months of assistance for rent assistance. And ESG can actually technically be up to 24 months. I don't think we've ever used it for that long, but it really can help bridge people who need more than 3 or 6 or some of the shorter term subsidies. So that's how it's been used historically. So we're really trying to find out if we can use that Chicago waiver. If we can't use that Chicago waiver because the moratorium seems to be being extended time and time and time again, then we will come back to council and recommend that we switch it to rapid rehousing. But we're trying to take care of that one thing. About the city manager saying of that 500,000, 50,000 was for repairs. I'm not aware of that, of the city manager saying anything about that. It's not how any of the money is allocated. Of that 500,000, 450,000 is allocated for direct assistance. In other words, rent assistance that goes to landlords, and up to 50,000 is allocated for connections to use for staffing costs. Obviously, when you're running a program like this, you have to do intake, you have to do case management, and there is a lot of financial management. And so they have to have the ability to implement the program. So that's what the other 50,000 is for.
Well, that's what I thought. And I said that, and when she said that at one of the other ward meetings, I was confused about it. Can I ask another question? How many people are still at the hotel, and what is the plan for that? And are you taking any more people at the hotel, and what hotel is that?
Well, I can address some of that. I don't know the exact number, but last I heard it was about 70. There are different people there who need different types of subsidies and assistance. And so some are actually in the queue for permanent supportive housing, for example. Some will be eligible or could be housed with rapid rehousing or something like that if we get more of those funds. And there can be rapid rehousing funding that comes through the city. There can also be rapid rehousing funding that comes from the county or through the continuum of care. So there are multiple sources for this. So Anybody on that in the hotel is on the waiting list, if you will, for different of those sorts of funding sources through the continuum of care. It's kind of complicated, and quite frankly, there aren't enough resources fast enough for all the needs. So it's really to prioritize the people with the needs, the deepest need, to get them to the services they need as quickly as possible. But it isn't as quick as it should be.
Thank you, Tina, for your questions. Are there any more people in the waiting for questions?
So all attendees have permission to, they should be able to talk at this point. Right. So if there are any hands up, please.
All right, if there are any hands up, fine. If not, let's move on. We have a lot of
I'm sorry, we do have one question from the committee.
Okay.
Right, and the question is, since these funds are CDBG funds, are those disbursements to rent aid following the guidelines of the CDBG funds that we have for any other monies that we use?
Not exactly. This is CDBG CV through the CARES Act. They made a bunch of changes specifically. The federal government used CDBG as a mechanism to get money out to a lot of communities that who they figured would need help, because all of the communities that get CDBG, and it's about 1,200 nationwide, have low and moderate income populations that qualify for it. But they made some changes to the regulations for this CDBG CV money. So it's normally with CDBG, we would not be able to do rent assistance for 6 months. We could perhaps do rent assistance for 3 months, but it's not a very effective mechanism for it. And I got to tell you, there's some really annoying things like the way it doesn't fit. CDBG is first and foremost was designed as a bricks and sticks, community development source of funding. And so a lot of times the way it works for services is not as flexible as a lot of the other grants. So that's why we don't normally use it for rent assistance.
I have a follow-up on that. Sorry, Anne, if I may.
No,
and
go
it
ahead.
is, thank you. And it is that my concern is that these funds then get allocated to areas that are not CDBG elected or conforming. I'm concerned that this money is then, because they're under a bigger umbrella, that will go to landlords that have more funds than the landlords that are within the CDBG areas that we have already designated in Evanston. That would be my concern with that, Sarah.
Well, CDBG, when you're using it for, what we have to do is use it for income eligible households in this case. So they don't have to be restricted to our target area. However, the way we're allocating the money, we've prioritized 3 census tracts that for the first phase of this that are in fact all in the CDBG target area. Okay. And so we're still trying to target our money, but basically we've targeted part of the 5th ward, a large part of the 8th ward, a little bit of just the way the census tracts don't match up with wards, a little bit of the 2nd and 9th ward are also included. So it's pretty much all the south from the metro tracts along Howard and between Howard and Oakton, west to the west side of town, then up the west side, roughly on Dodge, but not exactly, to about Main, and then from Church Street east to from the canal to Green Bay, and then up to where the canal and Green Bay Road meet. So the heart of the 5th ward. So we really are prioritizing our lowest income areas. Even if HUD didn't make us do it.
And we're prioritizing small landlords too, right?
Yes. In the first phase, it's just in those census tracts where there are more small landlords. But if we move to second phase, then it will specifically prioritize small local landlords. Yes. We just don't know if we'll have enough money to get to that second phase. I just want to give you a real quick update because if I can find it, it was emailed to me by one of my coworkers. But we had, we'd gotten 40 people had contacted through the city's portal. So that isn't even including to connections directly. We have city staff that are helping with this. And we had more than, I think we had 40 people who contacted us on the first day. So the demand is definitely there.
Yeah. Yes. Right.
The demand will outstrip the supply, unfortunately. So what we should
Hugo, is
move on.
that it? Anything else? Hugo, anything else? No. All right, so let me clarify the agenda. So Sarah, would you say this is mostly a staff presentation? I went through this carefully, the packet, and I'm not certain that there's any action on the part of the committee. Is there any approvals or just consensus?
Well, it's more consensus, but we do want to hear the input from.
Oh yes, but I mean, there's
HCDA.
no motions to approve.
Correct. It doesn't require action, and we we didn't want formal action. We also didn't do things like put in approval of minutes because we didn't want to have separate, because then we would have to convene each body separately to approve its minutes, and that didn't seem like the best use of everybody's time. So
I realize about the minutes, but I wanted to make certain that I didn't miss anything within the packet that required a formal motion or action to the council. Okay. All right, good. All right, so the first item is allocation process for mental health board, CDBG, public services funds, etc. And who's going to take on that presentation?
So Jessica's going to kick this off. We're going to pull up slides for you, and
bear with me. Hopefully everyone can see and hear. So yes, thank you, Alderman Rainey. This joint meeting of the Housing and Community Development Act Committee and Mental Health Board is to update everyone on the new unified process for allocating city funding, both Mental Health Board and CDBG, to provide services needed by Evanston residents that the city doesn't provide or doesn't meet the total need for in our community. Okay, it's one of the actions being taken to address systemic inequities and in access to services that impact some residents. So this is how we got here. This bicycle-inspired vision of inequalities where everyone gets the same bike that doesn't take their unique needs into account does provide a visual representation of how we hope to move from providing equal services to maybe providing more equitable services. The goal of the restructure is to make service delivery more equitable for underserved populations impacted by systemic discriminatory practices, and now also those most affected by COVID-19, to give those residents the support they need in a timely and cost-effective way. So this started with our Social Services Core Committee. The remaining steps in the Social Service Core Committee recommendation was to align funding for external agencies, CDBG Public Services and Mental Health Board, to the same purpose, to provide equitable opportunity to residents who face systemic barriers.
Jessica?
Yes.
Would you mind if people asked you questions while you were presenting, or would you rather wait and not be interrupted?
I can Can we hold questions until the end? I'm so
Yes.
sorry. I don't want people to lose
No,
questions.
no.
And, thank you for bringing that up, because people can type questions into the question box, and then staff can address them.
Perfect. Sorry to interrupt.
Also?
I wanted to know before you got into it. Thank you.
Thank
Good
you.
question.
I appreciate that. That was good. Okay. So the Social Services Core Committee, the city staff has sought input from community partners as represented in this slide, and some of them are here tonight. So that's great. These partners also serve many of the same underserved populations as indicated by their responses in our Community Needs Assessment Survey. And we put that out in the summer and fall of 2019 as part of our 2020-2024 consolidated plan. We know that agencies, we know that agencies can't provide for all of the needs of our clients, but either through referral or in our community. But because they are working with such complex populations, but agencies do refer to other agencies, and they track those referrals. So agencies are doing the best that they can. In spite of this, 65% of agencies responding through our Community Needs Assessment Survey also told us that clients who are eligible for services were not able to access them. So we have to ask ourselves, why? Why is this happening? The single biggest barrier to accessing services was the lack of financial resources, combined with unstable housing, no health insurance, and the inability to afford childcare or not having education or training for higher jobs. The people with complex needs and fewest resources also can't navigate our fragmented system to get the resources. And this was pre-COVID, but COVID-19 we know has had a tremendous impact on our already vulnerable populations. So it's heightened the need for an equity lens. Over 3 times as many Black respondents than white respondents report that they are not sure that they can meet average household expenses. And over twice as many Latinx households as white households are finding it difficult to pay for basic household needs. This is according to the US Census Pulse Survey from December 2020. So the new process would target services to people with the greatest needs using an equity lens. And this was presented and endorsed by Rules Committee in October of 2020. So how will this restructure help? The goal is to provide robust case management services for individuals and families with complex, multifaceted needs. These services would be funded using grants. Support services identified by people working with their case managers would be accessed rapidly, even if the client doesn't have insurance or doesn't meet CCAP requirements for funding assistance. But these services would be provided and paid for on a fee-for-service basis. We're also looking at safety net services, like providing food to people unable to afford it or who can't shop and prepare meals, domestic violence services, emergency shelter, street outreach, and drop-in services would also be grant funded. These services meet the immediate needs and work to connect clients with case management for deeper services as appropriate. Okay, so we're going to focus first on case management. Funding would get more people into robust case management plans and create the capacity on the side of the agencies to serve more individuals and families. Case managers are known for developing a holistic case management plan and meeting regularly with the participants they work with to assess progress towards these goals. Goals could include increased income to maintain stable housing, or getting training to qualify for higher wage jobs, or even getting childcare. Children's outcomes would also be tracked, physical and emotional health, school attendance, or through grade achievement or attainment. The relationships, the case management relationships we recognize can be multiple year or short, depending on the household's challenges to achieving self-sufficiency. But success is dependent on clients having timely access to support services. So we know that our fragment system puts the burden of locating services on people with the greatest needs and the fewest resources. The most equitable and efficient way to fix this is to pay for those support services in case management plans with fee-for-service agreements or procurement. This removes that barrier of the inability to pay, or it provides help navigating the system. It's also essential that we maintain safety net services, including homeless shelters, street outreach and drop-in programs, food programs, services to people experiencing domestic violence. These services are also critical for connecting at-risk residents and engaging them in case management or other needed services. So like healthy food for an out-of-work parent who can't afford groceries and pay rent, so these services are temporary but vital, but they can also, like a DV shelter that helps someone fleeing an abuser, the person involved in services might need a temporary alternative to returning to the abuser and would move into case management to achieve that goal. Okay, so this is a visual representation of our funding categories and how they interact with case management at the center, and linking clients to support services that would also be funded, and then safety net services providing those additional supports. So staff met with 35 agency representatives from 18 different agencies over the course of 2 virtual meetings to go over this new application structure. We went through the similar presentation, similar to the one we're going through tonight, followed by a question and answer session and discussion. And this is some of the input that we've received. There was a robust and interactive discussion at each meeting. We used Jamboards, which is a visual whiteboard that lets people comment anonymously. So the most frequent question was, how does my agency fit? What category do we fall under? So this isn't something that staff is going to dictate. Instead, the agencies are going to make those choices, and we're going to have smaller group discussions and one-on-one conversations with agencies to support them through this application process. The second biggest question was, how are payments going to work? And how does this affect program reporting and measurements? So these are all good questions. And it's important to include this information in the application, which we hope to present to agencies, and again, sort of work with the agencies so that everybody has a clear understanding of the process. We do have standards for case management services, including a measurement of progress toward goals. And these goals can be housing stability, living wage jobs, and improved health and well-being. So what are next steps? As we mentioned, we will have follow-up meetings with agencies, and we're preparing the Zoom Grants applications for case management and safety net services. There will be more discussion on support services, including identifying key services and working out payment schedules and processes for that. Our timeline is to finalize agreements for case management and safety net services by June, which we recognize is ambitious. And then we can identify support services and a payment system for those services.
So how does this impact our allocation process is the next question. Well, It's different from what we have done in the past. We have had, case management and safety net. Case management and safety net services will be grant funded. And we're recommending using a combination of CDBG and mental health board dollars. Part of that is there's a cash flow reason. Agencies that are funded entirely through CDBG, even when we say you're starting your work on an estimated grant amount at the beginning of the year, and we don't know quite when we're going to be able to give you money, we frequently end up giving them all their money in the latter half of the year, sometimes in a single payment because of when we get our money from HUD. That puts stresses on agencies. And let me tell you, if they use cash accounting versus grant-based versus accrual accounting, and they have a July 1st fiscal year, it also leaves them with a problem of they haven't received any funding in the January through June period, then they can't, if you're using cash accounting, you can't apply any of the funding to that period of time. So it also can mess with their budgets. I think the cash flow part is probably even more important, but both parts can be a problem. Support services would be funded by mental health board because it's infeasible to use CDBG on either on a fee for services basis or procurement. You can do competitive procurement with CDBG, or you can use grant agreements. But if you do competitive procurement, you have to open it to the world, nonprofits and for-profits, basically whoever. We can't limit the competition. So what happens is we could wind up, then you're basically dealing with the lowest responsive and responsible bid for services that we don't really, I just don't think it would work. Let's just put it that way. So we've combined, agencies are applying by category. So they're not applying by funding source because of the way we have to use the funding sources to make this process work. And we can't really have a separate mental health board review and a separate Housing and Community Development Act committee review that staff then tries to combine or something to figure out who to fund and at how much. So we're going to need to have a cross-board and committee group to deal with the services funding, or perhaps it should be a committee of the whole. That's something that I think is very much up to the board and the committee to discuss and see what they think about. It doesn't have to be decided at this meeting necessarily either. But that, I think, it's really critical. And it's really the only way we can effectively make decisions that will move the process forward and focus the resources on people of greatest needs and implement this new process. Now, we are working on developing an estimated dollar amount that might work for each category, but quite frankly, I don't believe that should be fixed. I think even if we recommend one, and what I would like to be able to do is develop a recommendation to bring to you in March before we actually are in the allocation process, so that everybody has that to frame. We should get our CDBG grant amounts by early next week, maybe even on Monday, which will allow us to have a better idea of, then we'll know how much CDBG we're going to have, which will allow us to do that more effectively. I think that there has to be some flexibility how, even if we do an estimate for each category, how the board and committee might want to actually allocate it based on the applications that we receive. We also will have a better idea by our March meeting from talking to agencies how they're planning to apply, which will help us do a better job. If we were to do it right now, Jessica and I would be estimating what different agencies would apply for, we think. And frankly, one of our discussions was, well, can I apply in the category that, or for a program that I have, that our agency hasn't applied for in the past, that we think fits this process more effectively? Yes, and we also have told agencies that if they want to apply in more than one category, they can, just as they've always been allowed to apply for more than one program or service in the past process to either mental health or CDBG. So we may come up with, we had one question, for example, can we do joint joint requests? And that would perhaps link case management with some supportive services from a single provider that they would give us, propose a different, a joint application for. I really think we ought to look at all the ideas that our agencies have, because many of them work very closely, and that could be a very efficient and effective system to have a formalized referral process for certain clients that would get them into those supportive services that we're talking about. So there still are quite a few unknowns, and I don't necessarily think we're going to get everything perfect by a long way in a first year, especially in a year that's as challenging to everybody as this one, because everybody's still reeling from COVID-19 and still trying to deal with that additional factor. But as you could see from all of the statistics, the need to really focus our funding to help these residents who are of greatest need, I think, is huge. And if we don't start now, it'll be much harder to start changing later on. I think that the urgency is there based on the need and what's happening in our community, and to facilitate recovery from COVID-19 on an equitable basis. Any questions, or what are your questions, I think is probably what I should say.
Do we look in the chat?
Yes, we'll look in the chat first.
There are no questions in the chat.
Right.
I put one in.
The core committee was the Social Services Core Committee, that it was the staff, cross-departmental staff group that developed recommendations on how to improve the city's delivery of services on an equitable basis. It was headed up by Kimberly Richardson, with Kathleen, I can't think of her name, she's the same person who is helping guide our equity work right now. She's at UIC. And it involved people who at the time were in Parks, Recreation and Community Services, the youth and young adults group. It included Audrey Washington's group, which was also in Parks, Recreation and Community Services at that time, the senior programs, as well as our human services staff that were in the Health and Human Services Department. It moved everybody into that single department, so under one sort of umbrella to better coordinate services. So that was the first step, and then this is the next step, which is to continue that and expand that to the way we give out funding to external agencies.
That was my question. Then I had another question. Under the allocation process, the last bullet point says, condition the release of payments and continued funding on the achievement of specified outcomes. Would you really do that?
Well,
I'm
not saying that it would be absolutely, if you said you hope to have X people do this, it has to be, we have to see progress and we have to see tracking. It's very difficult to say, I mean, many times we'll see goals like 80% of people or families in case management might achieve one or more goals, that sort of thing. It's not a hard and fast that they absolutely, it's not going to be like all the children will advance to the next grade, not that kind of measure, but it really is, the goal is to be specific so that we can see progress and measure progress. And if the agencies aren't measuring progress that way, then we it's really not going to allow us to evaluate how the program is working.
I saw that Becky had a question. I don't know.
Yeah. Do you see that?
I can't
it's
see it.
gone now. It's gone now. I don't know.
So Becky asked if we could give an example of a family with complex needs using this new model of care. An initial referral for need?
Just, that's an example.
What, looking for Lola?
Yeah.
She's
Sure.
in the note. The note.
Well, one example is a family who currently the wage earner or earners are not making enough money to have stable housing, and they're working multiple jobs. They may have, and they have children who they can't afford childcare for, but they haven't been able to access funding for childcare, or it may be something like they can't find childcare services that are at the time of day they need, that sort of thing. It can just be any number of things like that, where it's an example that we've used in the past is that the households that are frequently or in our TBRA program generally have multiple needs that are unmet. The driver of it is they simply don't have enough money and resources to get those needs, so that the individual needs can be obviously different among them. Does that help answer?
Not quite.
Okay.
Because that's my experience, is most people have complex needs. It's never one simple thing or
Right.
one service needed. So in that example that you gave, will there be, I mean, that sounds like, based upon what I'm understanding, the new formula is based upon that family's need would be childcare, job creation, etc. So is that going to come from two different providers, or is that case manager going to be one person who makes the linkages to these other providers? I'm not capturing.
The idea is the case manager will be making linkages and actually being able to, get the services in. Let me try another example. We have situations where people need some kind of healthcare. It can be mental health, it can be physical health, it can be everything. But mental health is one of the most common ones. They can't get into mental health services oftentimes very rapidly because they don't have insurance or any other way of payment. One of the things is we would like to be able to say, and this is, we discussed what the fee schedule would be with agencies, but be able to start somebody in services, paying for it, and then the case managers who usually work to try to get them onto insurance or whatever to sustain that. Similar things could work with childcare, where a short-term subsidy can sometimes help when you have a family where isn't eligible for CCAP because for eligibility for that, you either have to be in school full-time or working. And if somebody's looking for a job and has children, but could get maybe a 3-month period of time where they get a scholarship so they can find a job and get established and then transition to CCAP, is another idea of how this could work.
Okay. I think this will be a I'll understand this a little more as we go, because I just don't know then who that family would be, the different providers. Would they be working with all those different providers? Would they be working with a child care center? Would they be working with the job training or whatever? Do you understand? Like, are they going to still be?
Right, but they could be, because in many cases, case managers are already referring them to get other services, but they may need either some money to get into some of those services, or they may find that a program is full and how can they go to another one? They just go all over they get routed around. So part of it is to set up referrals that are organized in advance, shall we say, to try to get people into services. And if payment starting that off helps that happen is the goal.
I see.
Does that make sense? I'm sorry, it is complicated to explain.
I think I'm getting it. It's really just, it's providing the resources to based upon the client's needs directly to the different agencies. So the resources kind of follow the client. Right. It also gives us a better way of tracking outcomes from the resources right now, and making sure they're getting to, as I say, the people that we've defined as needing more boxes or a different bicycle. And that's the trying to navigate the system. Yes. Like I know, as being on the mental health board, where Trilogy, or Connections will make many referrals to Trilogy, but then it stops. The client doesn't quite make it to Trilogy, even though they've been referred. So this time there'll be some resources or more support to ensure. I think that's okay. Yes. And sometimes they're just put in a list or in a holding pattern until somebody gets them into some level of insurance that can then compensate that. And that is a huge challenge, we know. Yes. Okay.
In the chat, there's a question about what services are available for non-US citizens.
Well, one of the good things about CDBG, when you work with external agencies, is there is a don't ask, don't tell. They don't have to require checking citizenship or legal status in this country, which we actually have to do if the city implements its own programs. So that the services are really open to people who are not citizens. Because mental health board funding, I mean, locally, we've never put that restriction on the use of mental health board funds either, but by giving our CDBG to agencies, we allow them that same flexibility. So we don't screen for that.
The question is here, do you know any place where there is a restriction?
We can't give our own GA and EA to certain undocumented people, which is why we set up that separate fund at the city to try to do that. That's an example. And there are other programs that have restrictions too. I don't honestly know all of them, but it's an ongoing challenge to figure it out. And the other thing is, if you can do some things, but you can't do all things through a single program or channel, it becomes a real pain too. Housing, for example, is sometimes something that gets hung up on citizenship or legal status requirement. And that again, well, that's one of the reasons our rent assistance program is being implemented by Connections for the Homeless. Again, then they don't have to do that. If you're a governmental entity, you're held to a different standard when you're using your CDBG. I mean, it's really an annoying thing, frankly.
Good to know. Okay.
Hugo
so
has a
that-
question.
Yes, I
Yes,
do.
please.
And it's a follow-up on the U.S. citizen, non-U.S. citizen question. Is there anything that the city of Evanston can do to become more embracing of people that are non-U.S. citizens right now and be more open to promote that we don't ask? That it's like don't ask, don't tell. It's like shh, don't say it. And you know, people that have no documentation are in fear. They see a police car turning the corner and their legs start shaking. So and I think that maybe the city of Evanston could become a true sanctuary for non-U.S. citizens. I know that we use that term, but if we are about it, are we really giving the right message with that?
Well, maybe that wasn't the best comparison. I mean, we don't really, we don't ask, or at least when we're doing our services through our non-profits, if we're doing general assistance, my understanding is that then we are required to ask that. We don't have a choice because that's a requirement of general assistance. So the challenge is how to convince people who have been frankly intimidated and made to believe that everybody is out really not open to helping them by some recent, well, the policies of about the last 4 years, let's face it. We had this same problem with the census and everything else. I think it's just going to continue to take time, but we are working with as many different people as we can. I know you were offered to help with census a number of times, and I couldn't connect and get you as involved as I would like, but we work with Stephanie Mendoza and the Latino Outreach, Latino Resources, whatever the name of that nonprofit is one of the groups that we're working with. And we're going to just continue to do that. The challenge is how to overcome ingrained fears that have been fostered over a long period of time. I don't have the authority to recommend that we become a sanctuary city. We are a welcoming city, and I think that that's a little above my pay scale to determine if we're going to do more than that. So,
Alderman Braithwaite.
Thank you. I'll just be real brief. Hello, Mr. Rodriguez. We haven't had a chance to meet. There is, and I apologize, I'm listening on 2 meetings at the same time. Sarah, can you please put my number in Mr. Rodriguez's so we can get in touch? So there is a immigrant community that, did you already talk about, that's meeting on a weekly basis? I can get you plugged into that. In the past, we've had meetings at St. Mary's Church where we've brought together a number of the elected officials along with Spanish-speaking police officers just to explain, you know, what their role is in terms of law enforcement. They do not, I don't think anyone that you could come up with has ever been arrested and turned into ICE by our City of Evanston Police Department. So I hear and understand the concern, and I'd love to talk to you outside of the meeting just so you can be an ambassador for all the wonderful things that we are doing, particularly for the Spanish-speaking community. So Sarah's going to put my number in there. We can talk in the next couple of days. Fair enough?
I'll just send it to Hugo so it's not out in the chat.
Alderman Wilson.
Thank you.
Thank you.
And I think we kind of covered it a bit, but we, you know, the City Council did pass a sanctuary city provision and policy. And not only that, but once we kind of looked at that more closely, we made some amendments to that to clarify and make it even stronger that we don't stop people without, you know, a warrant or you know, specifically probable cause. So we, you know, have tried to do that. And in addition, we also, the Attorney General, United States Attorney General, made some threats as far as possibly withholding funding from cities like Evanston because of our policy. And we took a very strong position on that. And we were actually the lead plaintiff in suing Jeff Sessions, who was the Attorney General at the time. So we filed a lawsuit to challenge that and fight back against that. And we won that lawsuit together with a coalition of other cities. So, you Peter, kind of covered that. So it's important to try to get that word out in the community that we do have this strong position to be supportive, and we are willing to fight for those rights of individuals in our community who, otherwise might feel threatened.
Okay. Another thing that was in the chat was desperate need for more street outreach, especially for the homeless. And I don't know, as far as I can see, nobody's doing that in the areas that I'm on the street in. So I hope there's some special attention to be paid to that. I think there's just such a crying need.
And I think that we're going to see different needs, or our balance of needs is going to be different for this year and probably next, as we're, seeing how we come out of COVID-19, because you're right, we've had a huge increase in our homeless population that is, and more problems with how they can be served. And Tina pointed out, just by asking how many people are still in hotels, we can't get people out of the shelter into permanent housing fast enough for complex reasons too. But that's a good point, Alderman Rainey. Thank you. I see there's another question in the chat about changing this model to focus on persons with complex needs, not the agency. Makes me wonder if as many persons will be served. Thoughts, and will some persons currently served lose service? It isn't the intent of the process for anyone to lose services. It will depend partly on how agencies respond and how they, because most agencies serve way more people than are served only with our money already for multiple programs. So we are going to be focusing our money on certain, or on fewer people, so that we can actually take care of their multiple needs and hopefully move them to self-sustaining and fulfilling lives in a way that we haven't been succeeding at. So I think we're going to count fewer people. But one of the other challenges is right now, every agency responds with how many people they serve through a specific program. And we have no way of deduplicating if the same person is getting multiple services. And in some cases, I'm sure they are. So, we will probably be counting fewer people as served specifically by the funded activities, but there will be greater depth of service, which is something that we talk about sometimes when we're trying to evaluate programs. If somebody does a one-time meeting with somebody versus works with them for a year to help them improve their overall situation, we're going to count more people for one-time assistance, but that doesn't mean we're really moving the needle and really fixing people's situation, because we're not really counting the other things that they may be getting and being able to attribute the progress to the programming that they're receiving or not. We just know that somebody got one touch point. Does that answer that?
Okay, any more questions from the two committees? All right, Sarah, what's your next step?
Well, our next step is we are going to be meeting with agencies, as we said. We're going to be designing the Zoom grant application. We don't know if it's going to be a single one that's going to branch, or if it will be two separate Zoom grants applications, one for case management and one for the safety net services. But we will prepare that. Our goal is to open that application before the end of March. and then be able to hopefully move quickly to get, because agencies have are learning about this process. So they're already thinking about what they're going to apply for, so that we can get applications to the board and the committee for review. I do think that our normal CDBG committee meeting would be on the 16th of March, which is conveniently with our 128-day month that keeps it the same day. And if we could have a joint meeting, then we would take everybody through where we are on everything, and also hopefully get agreement on how to structure the allocation review committee, or the application review and allocation committee.
That's also the meeting to review our CAPER.
Oh, yes, we have to have a public,
CAPER.
we have to have the public comment period for the 2020 CAPER end, so.
Hey, Sarah, a quick question for you. How many agencies do you expect will apply?
I mean, from our meeting, it seemed like every agency, we didn't get absolutely all agencies didn't send representatives, but everybody seemed interested in applying. So I think we're going to have roughly the same number of agencies, which I think is about 20. Some agencies have multiple programs. So what happens is, in my head, I'm trying to figure out how many subrecipient or grant agreements we did. And sometimes, a single agency will have multiple programs. So that I can't dedupe in my head fast enough. One of the things we also think may happen is some agencies may ask for funding for certain services they provide that aren't the ones that they've always been funded for in the past, based on that.
Thank you.
Sandy, do you have a question? Sandy Johnson?
Yes, my question is, after this joint meeting in March, the end of March, and the questioning, when do you anticipate that the applications will be circulated or available?
Well, those we want to open by the end of March.
The applications?
The formal applications. We're going to be talking to people a lot, and we may have a draft that we're going to be circulating with them ahead of time.
So within 40 days, maybe, or whatever, the applications will be ready. And
we said it's a tight schedule. We know we're.
And then they would have what? Would it be about a month to apply, or whatever?
What we have usually we've given. Well, usually we have a two-step process. We have a letter of intent, and I don't think we'll do that two-step process. We'll just open the applications. I don't think we'll need necessarily a two-step process, because we're going to be talking with agencies, and we'll be getting an idea of what we think they're going to be applying for, which is really what that letter of intent was designed to do, try to figure out, so we could figure out how to structure the hearing meetings where where the board and the committee could hear from the agencies and ask questions. So, our goal is, as we say, to get applications in and do the review meetings. Well, probably would be the very end of April, and then possibly into May, and then get the funding recommendations that can be taken to City Council, ideally before the end of May, probably the last council meeting in May, and get grant agreements and everything up and running in June.
Really?
So it would be for the basically July 1st that the funding would be available?
Yes, but we also, depending on how organizations apply, and if they're applying for something that they are already doing and can track, we with CDBG, technically, we can make funding retroactive to the start of our fiscal year. And one of the things we're hearing from agencies is if some of the, well, I'll use an example of somebody who's already doing case management. Now, we want to be able to get new people into case management, but we also know that they're already working with people who meet the description of the individuals and households we are seeking to help. So it's possible that we can consider whether or not they can put some of their funding back to the pre-time, but that's more an accounting thing. Do you know what I'm saying? It's to try to help deal with their fiscal years and things like that. It doesn't, you know, we can't. I guess the ones that are easiest to potentially say could put funding back to an earlier point and could be more easily counted, which we did, like in 2020, we did that for actually all our agencies with both mental health board funding and CDBG because of the, all of our timing of funding release was delayed in 2020. And we were able to do that, could possibly be done with, say, safety net services, which are much more likely to be very similar to the services that programs that some of the agencies are being funded for.
So I guess I missed something. Were the agencies funded as of last, you know, we missed out on several months, or at least we hadn't met. So did agencies receive funding?
They did for 2020.
Yes.
Nobody has received official funding for 2021.
Okay. So you based it on the previous year's recommendations? The 2020?
No, so
No, 2020 allocations were made by the committee and the board.
Yeah, right,
and,
right.
And,
well,
and
they
those
made
were
that in
all
19. Yes, okay, yeah,
right,
got it.
right. And all those were released, yeah. Mm-hmm.
Yes. Thank you.
Mm-hmm. I know it's really hard to even remember what fiscal year we're in sometimes. I mean, that's what I'm finding. We keep saying last year. Oh no, last year was 2020, not 2019. You know, I feel like we missed a year almost in some cases.
Okay, where are we right now? We're, you want to move out of this and go into any kind of staff report you might have? Are we finished with the new changes?
We are finished unless there are any other questions. And we actually already talked about the thing that I would have just provided a brief staff update on, which was the rent assistance program. So.
Okay. Anybody, last call? Anybody have any other questions? I'm really interested in this on the street service, just really interested. Just I think our issues are getting worse and worse and more serious. I mean, I'm getting very concerned that we're going to start finding bodies on our street, and that is going to be just a horrific situation. Just I mean, devastating. And you know, there's nothing that an individual can really do. We can call the police, we can call connections, but there needs to be intervention before we're at that point. And you know, it's just, I mean, in the south end of town, it's getting very serious, and there's just nothing, you know, people are knocking on doors now, saying they need a place to sleep, and there's no place to sleep. So, and I know we're talking about a shelter, but very serious. So, okay, so shall we entertain a motion to adjourn? I hate to leave all you beautiful people, but if we have no further business, I will entertain that.
Move adjournment.
Okay. Is there a second?
Second.
All right. Thank you, staff. It was an excellent
Thank you.
presentation.
Thank you very much.
And the work accomplished to get to this point is very intense, and we appreciate it very much. Thank you, Mental Health Board.
Do we need a roll call vote?
Yes,
for-
we do. Yes, we do. But I'm just making a few.
Do we
comments.
need it to adjourn?
I thought we did. No.
Oh, well, let's do it. It's better
We
safe
do
than
for
sorry.
council. Yeah. we
Okay,
do.
better safe than sorry. Alderman Rainey,
Aye.
Derek,
Aye.
Irene. Irene,
Aye.
thank you. Ugo,
Aye.
I'm-
Archana,
I
aye.
always mess up your name.
That's fine.
Ms. Sue.
Aye.
Thank you. Alderman Nguyen,
Aye.
Sandy Johnson,
Aye.
Alderman Wilson,
Aye.
Alderman Ruth Simmons,
Aye.
and Becky Filer.
Aye.
And I promise I will get your name right. Now I've got a complete mental block about it. So thank you so much. I think I got everybody. Thank you.
All right.
Thank
Thank you,
you.
everybody.
Thanks,
Bye-bye.
everyone.
Thanks,
Bye,
everybody.
everybody.
Have a good night all.
Bye.
Aye.
Bye.